Hello everybody. So let's see about pancreatic cancer. So pancreas is an organ leaf-like structure which secretes digestive enzymes required for digestion of a food, and it is also the orchestrating network for maintenance of blood sugars, which means it not only secretes insulin but it also secretes glucagon, which is required to maintain the glucose homeostasis. Now what all can cause pancreatic cancer? Pancreatic cancer can be predisposed by congenital genetic factors, prolonged alcoholism, smoking, and few other rare causes can lead to pancreatic cancers. Now how does pancreatic cancer manifest by itself? Unlike other cancers, pancreatic cancer manifests itself quite late, can manifest as jaundice, yellowish discoloration of eyes, yellowish discoloration of urine. It can present as itching, intense itching. There can be pain in the upper portion of our abdomen which is radiating to the back. There can be unintentional weight loss, and there can be decrease in one's appetite. So if you are a middle-aged men having any of these symptoms, do yourself screen with your basic ultrasound scan. So that brings us to what are the tests to be done to identify it. So no blood test can identify by sure that this person can have pancreatic cancer, but certain things can give an idea that what tests may be required for him, so that we can tell this person can have pancreatic cancer. So liver function test can give us an idea of about jaundice. CA99 is one of the tumor marker which can give us an idea about this jaundice could be a kind of tumor or how it responds after treatment. But the basic diagnostic modality is by imaging. Ultrasound is again a screening procedure, but CT scan and PET CT are the ones which can definitely say whether there is a mass in the pancreas and whether it could be a cancer or not. Having said that, 70 to 80% of the pancreatic cancers are usually identified at an later stage, not an earlier stage, advanced stage, in which the treatment will be only palliation, but rest of them, 20% of them can be treated with surgery, chemotherapy plus or minus radiotherapy. So earlier surgery was like it was an open surgery with a mortality nearing 20 to 30%, but with the advent of minimally invasive surgeries, which includes both laparoscopic and robotic surgeries, and anesthetic improvement, the mortality has come down to nearly 2 to 3% only. So if we identify pancreatic cancers early, certain kinds of pancreatic cancers like IPMN and neuroendocrine tumors of pancreas have very good prognosis. If we operate these cancers at a particular stage or a proper early stage, then their 5-year survival is as good as more than 80%. But in case of pancreatic adenocarcinoma, the 5-year survival, if they are operated in early stage, will be around 40 to 60%. So don't ignore any of the symptoms like jaundice, weight loss, upper abdomen pain radiating to back, and loss of appetite. Get yourself screened with ultrasound and basic blood test. If doctor seems something is fishy, get a CT or a PET CT done as advised by the doctor. Don't be worried about the surgeries, because these days we have minimally invasive surgeries, both laparoscopic and robotic. Though it's a complex surgery, still it's feasible, and we do not compromise in removal of the cancer tissue. So that is called as Whipple's procedure and distal pancreatectomy, which can be very well done within the gamut of laparoscopic and robotic procedures. So pancreatic cancer identified early can attain a near cure. Don't ignore any of your symptoms. Get yourselves tested. Thank you.